time. That is welcome aboard, my people. Welcome, welcome. As we get in the chat, let's see what we did here. Last time we did some things, and we took our person to the laboratory to check on heart conditions, and the person right now is going to a radiology department, and in the radiology, listen to me, my heavy tongue swelling down. Now, in the radiology department, we get some machines there. There are one machine that is called the EKG. It's called the electrocardiogram, and there is another machine that is called the echo ECG. So today I'll give the basics of echo ECG. The echo ECG, the not echo. Echo is like an ultrasound, because it is called echo because it is producing some, ultrasound makes some sound waves, and they when they pass through your, welcome guys, as you welcome to the channel, have a like bar, put your like, and then we continue. And we feel good. You feel good. You see, when you come to the channel, you meet Benjamin, the wise guy. Benjamin, the wise guy, talks to you. We feel good. We feel good, and then the feeling good says that you like. When you feel good, you like. Good afternoon, Dr. Benjamin. How are you today? I'm strong and fine like nothing else. Smile in the city. Big up all the time, big up all the time, big man. Jamaican uncle in the chat, Jamaican uncle in the chat. I see you, Jamaican uncle. Welcome to the chat. Now we were talking about the what? The radiology department. The radiology means machines that are able to look through your through your body to see what is happening inside, and then we take a picture. After taking that picture, we get to know where the heart has a problem. Just a recap of last time we did now. After we have examined the patient, we took the patient to the laboratory, the blood, and we saw the things that we can do in the laboratory, like troponin, creatinine. You see all those, the low density lipoprotein. I think a recap is important, because the first thing when you take a patient to hospital, this patient needs to be examined. We have examined the patient. We have done everything that we need to do, like giving these patients resuscitation so that this patient cannot go. We have given oxygen. Now it is time to check our patient and know where the problem lies. Where the problem lies. That's why we took the blood to the laboratory. After taking the blood to the laboratory, what did we do? We said yes, all these have come, and it is coming to it is coming and showing us he has this and he has this and he has this. So if the troponin is high, if this is high, if the creatinine is high, and we saw troponin comes from material place that is a place that has issues. What can we do so that we know where the issue is? We take the patient to now the radiology department, where radio means waves, radiology. You are put on a wave, and then we check inside. We say radiology department contains like x-ray, it contains like ultrasound. So in heart conditions, what we do an echo ECG, like an ultrasound, ultrasound. You know, when you want to help a person, the diagnostic tools help you to get to where the problem is. You don't gamble with a person's body. You don't gamble with a person's health. So we want to be diagnostically. We want to find the problem where it is. And now there are several machines that I will explain today before we get to the overview of the overview of EKG. There are machines, a minute, machines that there are some machines that help so that we can look inside the heart without hurting this person, so that we can see where the problem is. You see, there are so many things in managing a patient when it comes to heart problems, because now we have not started treating, we are just finding where the problem is. Where is this problem coming in? Now we have the chest x-ray. Everybody knows what x-ray is. We have the chest x-ray. X-rays are rays that you are exposed to, and when you are exposed to these x-rays, they pass through your body. I can see Jay Kingre in the house. Kingre, welcome to the house, man. Let them likes flow. Let them likes flow. If you have not liked and you're watching, please let the likes flow. Let the likes flow. Let's move. Let's give impressions to others. When you like, someone else gets an impression. So let's flow with the likes. Let's flow with the likes, my friends. Now, you see, Sana Alaba. What, mom? It's too long, mom. Woo, you've gone so long. Hope you are doing good and everything is fine. Thank you for tuning in today. If I had your number, I could call. I could call. I missed you, Sana. Hope South Africa is fine. I think you are in South Africa. I can see my sister Margaret from Norway doing good. When she's around, I smile. I feel everything is okay. Welcome aboard. Welcome to the platform. Don't forget to hit the like button. Today, we are talking about things that help us to get there, the things that help us to get the problems in the heart. Yesterday we were in the laboratory. Today we are in another department called the radiology department. Smiler. Smiler in the city is here. So when you are in the radiology department, we have some machines that help us to check in the heart. Now, when we say that a heart has a big ventricle, if you go to the X-ray, you will see it. And remember, I said when the rays are passing through a person, let's say the X-rays, what you see, if you have not liked, my guys, if you have not liked, just like those, that when people are coming in, they continue liking, they continue liking. If there is a fluid somewhere and those rays are passing, what will you see? Will see a bright area. You will see a bright area. But if it is air, you will see a dark area. So when you see part of the chest has some light, bright area, it means blood is around there. It means blood is around the heart. So that's why when you do an X-ray, some parts come bright, some parts come just like the video as you join in the chat. So good, Swaila. Thanks a lot. Thanks a lot. So that is called an X-ray. Some rays pass and then they are taken. I remember sometimes before the technology reason, and there are so cameras were there. The cameras, we were getting a film, we place inside the camera, and then we expose to light. So it takes the contrast, the contrast, and then you go and take and bring a picture now from the photo studio. That is the same thing that the chest X-ray do. So chest X-ray can be used to detect cardiomegaly if the heart is big, identify pulmonary edema if there is a lot of fluid that is passing to the heart, detects pericardial effusion if there is fluid that is in the pericardium, if there is a lot of fluid in the pericardium, assess pulmonary congestion. These are things, you see, if you are seeing fluid is filled and the chest X-rays can show us the light inside, you see, we know, this is this. And the advantages of this is the chest X-ray is fast, it's not so expensive, and it is widely used. It is widely used. But we have something else that is called echocardiography. It is the cardiac ultrasound. It uses sound waves. So when the probe is placed on your chest, what does it see? You see it characterizes the flow. It beats the flow as it beats. You get it? It characterizes the flow. So there are several types, and I know some people tell me this one is these are complicated words. Just listen to them. Transthoracic echocardiography, thoracic bone here passes through. You place those probes like this. I know some people have seen them. The probes, you place them here as they produce sound in your chest. As you produce sound in a chest, the machine is giving us pictures of what is happening inside. There is something called Doppler's ultrasound, which shows us where the blood vessels are clogged, where the blood vessels are clogged. There is something called stress echocardiography. You see, that is an ultrasound just like the other one, but it's special for the heart. Then there is cardiac computed tomography. Cardiac computed tomography provides details, cross-sectional images of the heart coronary arteries. So when we want to see the heart arteries, how they are, we check on cardiac computed tomography. You see, very nice, very cool. So that when we are dealing with something, we know that this is the specific area that we want to manage. You see, very important. We have something else called cardiac magnetic resonance, cardiac MRI. Just like the MRI, the big machine that you put in someone and then the magnets take the wave and then it brings us pictures. This is another. It uses strong magnetic fields. This one is used to myocardial variability and fibrosis. I said fibrosis is some areas that have were injured, but now they are producing some tough areas, making the heart not to contract and relax well. Diagnosis cardiomyopathy and myocarditis. I said when you are hear anything like myocarditis, carditis is infection. Myo, I say this, muscles. Evaluate congenital heart diseases that someone has have been born with, like in kids. You know, congenital heart diseases. We talked about them. Dorothy, welcome to the platform. Thank you so much for tuning in this platform. Always welcome, always welcome. So, congenital heart diseases are those diseases that people were born with. Detects pericardial diseases, the muscles themselves, pericardium, the muscles of the body. And then we have something called coronary angiography, cardiac catheterization. You take something like a pipe, and it has a camera, visualizes coronary artery from inside. It's used to detect some blocked coronary arteries. Diagnose ischemic diseases. You see, diseases that are ischemic, diseases that have, sorry, there is something which is making noise here. Yes, it is used to detect some noise, some blocked arteries. Guys, procedures such as angioplasty and stent placement. This one, when you place a camera inside the veins and then you push it, you pull it down, sometimes you may have these valves that are destroyed. So when the valves are destroyed, what you do, we put the coronary angiography inside, and then when you put it, it has a light, so it guides you on where it gives you the light. You look at the video, and then you can place the stent where you want. Well, it is used in surgery very much. Nuclear cardiography in imaging. Nuclear, that one, myocardial, it is like SPECT. It is like imaging, the normal imaging like MRI. Those are the things that you do when you go to to check someone. But there is this special thing that is called the EKG. EKG, that is what people use so much. So guys, fellows, thank you so much for those who tuned yesterday when we were doing brick by brick at Jamaican Uncle. I've seen so many people have said the session was lit like nothing before. Big up for everyone who tuned in. It was lit by indeed. It was lit. We could go up to morning, but we couldn't because some people needed some rest. Big up everyone. I can see the likes are coming in. The likes are coming in. Please continue giving the likes so that we get the impression. So here we talk about medical issues, discussing about our health, both socially, importantly, both socially, emotionally, mentally, and what? Physically, where the pilot is Dr. himself, Benjamin, the wise guy, I say. Now, if you have a question regarding anything, place it in the chat. Place that thing in the chat so that we can go through it and analyze and then help each other on the way forward. Now, the EKG. What is an EKG? An EKG records the electric activity of the heart. You remember we talked about the conductive system of the heart, where we have the sinoatrial node, we have the ventricle, it's behind me. Look, we have the sinoatrial node, we have the atrioventricular node. So what we say is the ECG, the machine itself, it records how these impulses travels through this heart. This machine is usually sensing the electromagnetic field of the heart. So when you have a problem and the conduction is not going so well, you will see it producing some waves. So the basics as we go on says this. It says that the basic says The electric, it records electric activity of the heart. Understanding the basics will help you so much to do what? At least to know what your patient is going through, and at least to know that this is what we expect and this is what we don't expect. What an EKG measures. What does it measure? It's important to know what an EKG measure. Okay. Now, the heart electrical system controls conduction, contraction, and relaxation. You remember when we were talking about depolarization, the positive ions going inside the muscle cells and then it contracts. Yeah, that is the electricity that we are talking about. And then it goes down to the ventricles from the atrioventricular. And then atrioventricular, when the ventricles are depolarized, it contracts. So it is the electrical system that is helping the contraction and relaxation. Why are the guys not? Today we are talking about funny things or what? The likes are not coming in, man. The likes are not coming in. Bring the likes, bring the likes, bring the likes. If you have not liked, check it out and like the chat, like the chat, interact with the people that are in the chat, interact with them, say hi, say something that you need to be helped there. So the heart electrical system controls contraction and relaxation so that your blood can be pumped. So the sinoatrial node starts an impulse. You remember, the sinoatrial node starts an impulse, and then AV node delays the impulse. This we discussed about it. And then bundle of His is this here that pulls the impulse to divide to take to this cardiac muscle so that your heart can contract and push blood. Eh? It spreads the impulse. The EKG, the machine that now we are taking this person of ours, you remember this machine here, these images. Let me put these images up. Let me put these images up so that you can see them. I put this here so that you can see them. Remember this machine that is behind me, this thing that I drew and put some probes in it. These probes that we put here are the probes that are monitoring the electrical system, because itself it's an electrical conducting system. The heartbeat has key components. The P wave, I explained the P wave is when the sodium, the positive ions are going through the cell, and then the heart constricts, constriction happens. You know, when the positive ions go inside, it is depolarized from the normal resting place that is resting. So it contracts, and then the atrium, the atrium itself, may stay like this. When it depolarizes, the atrium itself does what? It constricts. So it pushes blood inside here. You get it? It pushes the blood inside here. When it pushes the blood inside here, you know, it has delayed. This atrioventricular node delays the electrical system. So as it delays, it gives way for blood to come to this ventricle. So smart. Yeah? God was a genius. God is a genius. You see, creating a man with a heart that does this. And then, guys, increase those likes. Big up for those who are liking. Let me see some more likes coming in. So when the sinoatrial node is emphasis. A late student is here. Greetings. A shy girl. Yesterday you say you are shy on camera, but it's okay. One day you'll have the confidence on camera. Now, when this one contracts, we have where is that thing? Oh, let me see. Let me use a pen. Now that we have put the probes on our person, Remember, I said there's these probes that are looking at this person. They are looking at the heart in all different directions. They are looking at this person in all different directions. So when we have put our person on those probes in the heart, the probes in the heart, and we want to see how the person is. Just a minute, I prepare this. I really need someone to help me with preparing. Here, yes, you will see. You will see. Where is my pen? This one. Now, men, likes. Give me impression to other people. If you don't like, the impression will be low. So increase those likes from 3, or I'm not seeing them well. Yes, increase those likes, man. Give us those likes. So when this actual node is contracting because it has polarized, I said polarization is the sodium ions are getting into the cells of the muscle. So when the positive ions are getting into the cells of the muscles, what happens? The cardiac muscles contract, pushing blood down to the ventricle. And when they are pushing blood down to the ventricle, the atrioventricular node is delaying the signal. So at our ECG, you see we have put the probes. At our ECG, we will see a pop-up, something like this. Is everyone seeing that correctly? Or I use bold lines. So